Hey everyone, imagine this.
You're fresh out of a long day seeing patients.
And all you want to do is catch up on those new hormone therapy guidelines from the North American Menopause Society.
We're talking the 2022 position statement.
The one endorsed by practically every major organization,
Right.
but who has time to actually read it all?
And who wants to? To wade through pages of medical jargon when
Right.
you'd rather be,
Yeah.
catching up on, well, life.
Exactly. That's where this deep dive comes in.
We've got the key takeaways for you. Hot flashes, bone health.
Those long-term risks, everyone's worried about all broken down.
Right.
So you can walk into your next appointment feeling confident and informed.
Absolutely. Let's jump right in.
The guidelines still see hormone therapy as the gold standard.
For managing those pesky vasomotor symptoms
Right.
or VMS hot flashes, night sweats.
You know, the drill.
Yep.
And there's still a winner for preventing bone loss and fractures.
So, no big surprises there.
But what really stood out to me was the emphasis on individualized treatment.
It's easy to get caught up in guidelines and forget that every woman sitting across from us in the exam room is unique.
Couldn't agree more. The statement really hammers home the point.
That age is a key factor
Oh, yeah.
in that risk-benefit analysis.
Okay.
For women under 60 or within that 10-year window after menopause,
The benefits of hormone therapy, especially for VMS and bone health,
usually outweigh those risks.
that 10-year window seems to be the magic number, right?
It is. But here's where it gets interesting.
Once you start looking at women over 60,
Or those who are more than 10 years post-menopause,
Right.
the decision-making gets a lot more complex.
yeah,
Those concerns about heart disease, stroke, blood clots.
even dementia
Right.
may become much more significant.
So longer-term hormone therapy in those cases.
Really requires a thoughtful conversation, wouldn't you say?
Absolutely.
Like those persistent hot flashes might be a good reason to continue.
But we need to weigh all those factors.
Shared decision-making is paramount.
And it's not just about ticking boxes on a medical history form.
Right.
It's about really listening to your patient's concerns and goals,
Right.
understanding her individual risk factors,
Yeah.
and finding a treatment plan that aligns with her needs and preferences.
And speaking of individualized treatment,
How do the guidelines address genitourinary syndrome of menopause?
or GSM this time around.
We see so many women struggling with those symptoms,
You're right, it's incredibly common.
and often overlooked.
Yeah,
For those bothersome GSM symptoms.
that don't respond to over-the-counter options.
Right.
The guidelines recommend low-dose vaginal estrogen.
Makes sense. So we're talking vaginal dryness, discomfort.
Those types of things, right?
Exactly. But here's a crucial point for your practice.
If GSM is the only concern,
Okay.
and those over-the-counter options aren't cutting it,
Right.
systemic hormone therapy
Meaning oral or transdermal?
isn't the first-line recommendation.
Start with vaginal estrogen.
Okay.
There are also other options like vaginal DHEA.
Or oral aspimifene.
Okay. We've got to consider those too.
Good to know. Now, let's face those risks head on.
Because we know that's what everyone's thinking about.
Right.
Blood clots or VTE.
Always top the list.
Right. And the guidelines touch on some interesting findings there.
There's a suggestion.
That non-oral estrogen therapy,
Okay.
like patches.
Might be a safer bet for women who are at higher risk for VTE,
Okay.
although we need more research to confirm that.
Okay. Interesting. So route of administration could play a role.
Is there anything else related to VTE risk that stood out to you?
Actually, yes.
The type of progestogen we use seems to matter too.
Okay.
There's some evidence suggesting that medroxyprogesterone acetate.
Or MPA
Right.
might be associated with a lower risk of VTE compared to other progestogens.
That's fascinating. So we're not just thinking about estrogen anymore.
The progestogen component is important too.
Right.
I'm already starting to think differently.
About how I approach those prescriptions.
That's what we like to hear.
Now, of course, we can't talk about hormone therapy.
Without addressing the elephant in the room,
Right.
breast cancer risk.
Of course.
This is where the findings from the WHI study become really important,
Absolutely. WHI study.
always sparking debate.
What did you make of their findings on breast cancer and hormone therapy?
Well, it's complex.
That's for sure.
Yeah.
The study found that the combination of oral conjugated equine estrogens.
Or CEE
Right.
with MPA was linked to an increased risk of breast cancer.
But
This is big.
Using CEE alone was actually associated with a decreased risk.
Right, it's a real head scratcher, isn't it?
It is.
And it underscores how crucial it is to consider the specific types of hormone therapy we're using.
Right.
The estrogens, the progestogens, the route of administration.
Yep.
It all factors in.
It all factors in. It's like
Yeah.
it's like trying to solve a puzzle, right?
It's like trying to solve a puzzle. Right?
All these different pieces we have to fit together
Right.
to get the best outcome for each patient. Exactly. And we can't forget that hormone therapy, particularly long-term use,
Can make those mammograms trickier to interpret.
definitely something to keep in mind.
Right.
Now, what about heart health?
Right. What about heart health?
It seems like that's always a moving target when it comes to hormone therapy.
It really is. The research suggests
That younger women,
right,
those starting hormone therapy close to menopause,
might actually have a lower risk of heart disease.
right. But for women starting therapy more than 10 years after menopause,
The waters get a bit murkier.
so that 10-year window strikes again.
It does.
Yeah.
And we're still learning about the ideal doses.
Types of hormones
Right.
and how long treatment should last
Right.
to truly optimize heart health in women using hormone therapy.
So much to consider. And on the topic of ongoing research,
What did the statement have to say about mental health and hormone therapy?
there's a lot of interest in that these days.
Definitely. There's some evidence pointing to estrogen as a potential help for...
Perimenopausal depression.
Okay.
Those women in the transition phase leading up to menopause.
That makes sense. Hormones going haywire.
Mood swings.
Right.
A tough time.
It is, but the research suggests...
That estrogen might not be as effective once a woman is postmenopausal.
So not a cure-all for mood issues, unfortunately.
But even if it doesn't directly address depression in all cases.
Hormone therapy can still be a game changer
For
for a woman's overall quality of life, right?
Absolutely.
Thinking about sleep,
Energy levels
Right.
and, of course, sexual function
you're absolutely right. Improved sleep alone can have a domino effect.
on a woman's well-being.
Right.
Mood,
Right.
energy.
Even cognitive function.
Right.
And let's not downplay the importance of a healthy sexual life.
For overall quality of life,
Of course.
that can make a huge difference.
Absolutely. Now, before we wrap up,
I wanted to touch on primary ovarian insufficiency.
or POI,
Right.
the statement really stresses how essential hormone therapy is for these women.
And with good reason. We're talking
Wait,
about...
Younger women experiencing menopause prematurely,
Right, yeah.
their bodies are being robbed of those crucial hormones.
Far earlier than expected.
Right.
And that can have significant long-term health implications.
Particularly for their bones.
So it's not just about managing symptoms for these women.
It's about replacing what their bodies should be producing naturally
Exactly. It's about safeguarding them against the long-term risks.
that come with premature estrogen deficiency.
Right.
It's like we're stepping in to provide that hormonal support.
Their bodies are missing.
It's amazing how much we're still learning about hormone therapy,
And its impact on women's health.
even as we're using these treatments every day in our practices.
Absolutely.
Yeah.
It's a field that's constantly evolving.
And that's what makes it so fascinating.
Speaking of fascinating,
Diving into these guidelines has sparked a thought for me.
I'm all ears.
With all this emphasis on personalized treatment,
How do we get better at identifying which women?
especially those past that 10-year window we keep coming back to, are good candidates for hormone therapy in those later years?
Right.
There's so much to consider.
Yeah.
As we've discussed,
Yeah.
it's not always clear-cut.
You've hit on a crucial point.
It's not as simple as looking at a calendar.
And making a decision based solely on age.
Right.
We have to consider her cardiovascular risk factors,
Right.
her family history of breast cancer,
Mm-hmm.
her lifestyle choices.
Right.
So, of course.
The severity of her symptoms and her personal preferences.
Yeah.
It's about putting all those pieces of the puzzle together.
And those pieces can be complex.
Some women sail through menopause with minimal symptoms,
Right.
while others are really
But
struggling.
how do we factor that in?
That's where our skills as clinicians come in.
We need to be keen listeners.
Right.
Asking the right
Mhm.
questions to understand each woman's unique experience. Are
Mhm.
her symptoms disrupting her daily life?
Right.
Her sleep, her relationships.
Right.
Those are important clues. We also need to be aware of the limitations.
Of current diagnostic tools.
It sounds like we need better ways to assess individual risks
Sure.
and tailor those treatment plans even more precisely.
Right.
What's on the horizon in terms of research?
There's a lot of exciting work being done.
Researchers are exploring new biomarkers
Okay.
to predict individual responses to hormone therapy
Okay.
and also looking at genetic factors.
That might influence both risks and benefits.
Okay.
There's also growing interest in personalized hormone profiles.
Going beyond just estrogen and progesterone
Right.
and looking at the bigger picture of hormonal balance,
It sounds incredibly complex.
but also incredibly promising.
Right.
Knowing that there are researchers out there working to unravel those mysteries
Gives me hope that we'll be able to provide even more effective.
and individualized care in the future.
I share your optimism. This is an area where we're constantly learning.
And refining our approach.
Right.
It's about staying curious.
Staying informed
Yeah.
and always putting the patient at the center of our decision making.
Beautifully said. And on that note, I think it's time to wrap up this deep dive.
But before we go,
Sure.
we want to hear from you.
What are your thoughts on these updated guidelines?
What resonated with you most?
What questions are still swirling in your mind
Yeah, we've covered a lot of ground today.
from the latest research on risks and benefits?
To those nuanced clinical pearls that can make a real difference in your practice.
Right.
But this is just the beginning of the conversation.
It is, and it's a fascinating one for sure.
So head over to our website or find us on social media.
And share your insights.
Yes.
We are so eager to hear your thoughts.
Until next time, keep diving deep.